Growing up, I was a really unhealthy kid, and by the time I was like 4 and 5, I couldn't breathe, I couldn't hear, like I was all jacked up. So when I was in first grade, I got tubes put in my ears and tonsillitis. Even then, it's like I couldn't breathe then. It was just accepted that I'm always gonna breathe through my mouth.
Good, man. How are you?
We shaking hands, what are we doing?
Sure, we can do
Good
that.
stuff.
We're bring back some old school traditions.
Yeah, right?
So you go by
Andy.
Andy.
Yep.
All right, Dr. Hender, very good to meet you.
Nice to meet you.
So I have your scan here, which I'll take you through in just a second.
Okay.
But just kind of looking through that first note, it sounds like for you, a lot of snoring, kind of nasal, congestion at night, mouth breathing.
Yep. The biggest thing that I guess the challenge for me is I play a lot of volleyball, I stay active, and I'm always the first one out of breath. Sounds weird, but I can never seem to, when I need to, breathe.
Right.
And I naturally don't breathe through my nose, and when I do force myself to breathe through my nose, I feel like I'm suffocating.
Okay. The fact that you have never been able to breathe well through your nose but are a mouth breather, like that in itself is an issue. You know, when you go off to sleep at night, this needs to be open, this needs to be shut. So I'm gonna orient you and then I'm gonna take you through this from front to back.
Okay.
Okay, so basically, this is you looking out at yourself from the screen. I break the nose up into kind of two areas. So here's like the main tunnel of the nose is kind of what I'm circling.
Yep.
These tissues that come from the sidewall towards the septum, those are called inferior turbinates, and they're basically these thin bones covered by really spongy soft tissue. Those guys will get big and small throughout the day. When you lay down at night, they get more engorged, which is what really pinches off the airway. And so everybody's nose is not going to work as well on their back or side as it's going to be when you're upright. I know that, you know, the more space we can increase between turbinate and septum, the better you'll breathe day night.
Yep.
Okay.
I mean, I'm leaning towards office procedure because if it doesn't work, then we go into the knife and
Right.
go full hoop.
And I've had the office-based procedures done for me too, so I can speak from just personal experience from a sleeping standpoint. I don't have sleep apnea.
Yeah.
For me, it was a snoring issue and mouth breathing.
Same here.
Right.
Yep.
And I have a deviated septum, but I wasn't going to go under the knife for, you know, because I didn't want to take a week off work.
Yeah, I'd say we do that.
Andrew?
Hi.
Hi, my name's Anat. I'm the treatment coordinator here. I'm gonna have you follow me to my office. So I'm glad to hear you had a good visit with Dr. Handler.
Yep.
It looks like he recommended an in-office procedure.
Yep. After sitting down with Dr. Handler, it was good to know that I don't have to go with the full surgery. It's one thing to think that you're a mouth breather and know that you snore. It's another thing to have a scan or some scientific evidence to make it sound like I'm not crazy. Because all my life I've just been told like, well, just deal with it. And now, for the first time ever, someone's saying, well, no, there's an option. It's better. And so it was very reassuring. Like I feel confident about the fact that I was just born this way, but there's something we can do about it.